Hello, my name is Robin McNelis, and I'm a clinical specialist physiotherapist who's been specialising in breathing pattern disorders for more than 20 years. So as you can tell, this isn't something that's just new to COVID. Today, I'm going to talk a little about how common breathing pattern disorders are with post-COVID patients. The multiple non-respiratory symptoms that patients may suffer will be highlighted, and the fact that breathing retraining is an effective tool. It can help to give clarity to other symptoms that your patients may be experiencing. There are various different assessment tools that will talk about the cardiac, respiratory, and other symptoms which may present when somebody has a breathing pattern disorder. There are links to the relevant questionnaires here, and they will help to guide your assessment of these patients. There are two main common presentations of breathing pattern disorders. Hyperventilation syndrome is a biochemical problem which is caused by the alteration of CO2 levels within the body. One of the common symptoms with this presentation is air hunger, and there are also non-respiratory symptoms like dizziness, brain fog, and tingling in pins and needles at the fingers. This is caused by the alteration of the pH due to the lowering of the CO2 levels. Dysfunctional breathing patterns are when there's a biomechanical problem. This is overuse of the accessory muscles around the neck and shoulder. Patients will have an uneven rate, rhythm and depth of breathing, and will be breathing with their upper chest rather than to their diaphragm. Quite often, those patients will also be mouth breathing rather than nose breathing. And of course, you can get a combination of both elements. You may be asking yourself, what can I do as a GP to help? Firstly, assess, investigate, and treat any underlying causes that could be causing a breathing pattern disorder as a symptom of those causes. Give patients reassurance. They're often told that tests are fine, but the patients don't feel fine. You need to give them some explanation and some reassurance that they're going to be okay. Ultimately, they've got into a bad habit of breathing. Refer to physiotherapy so that we can assist patients with further education and the retraining of their breathing pattern. There are also some self-help resources which patients can use whilst they're waiting for physiotherapy. The links are here for the physiotherapy for breathing pattern disorders group and for the long COVID physio group. Both are excellent resources that patients can get working on before they manage to see a physiotherapist at the long COVID clinics.